Healthy Health Assistant was developed here in Nigeria, so we will be giving our experiences. But before I talk about what we have found with Healthy Health Assistant, we have to start with what is the background situation, the context. We first did an evaluation of hypertension in the country. Nigeria is a population of about 200 million, even above 200 million people. And we moved around the country and we discovered that 38% of adult Nigerians are hypertensive. The implication is that 4 out of every 10, about that, Nigerians are hypertensive. And out of this number, only about 60% of them are aware of their status. But that is not the summary, the final end of it. Just about 1/3 of them are receiving treatment. And out of this number who are receiving treatment, less than 1/3 have their blood pressure under control. So you could see the terrible situation we have found ourselves. Hypertension is the bedrock of practically all non-communicable diseases. We talk of stroke, heart failure, kidney disease, are all entrenched in hypertension. Of course, diabetes also contributes, but the most contributor of the global disease burden, has remained, hypertension. Now, having said that, as we kept battling to look for ways of mitigating this terrible situation, that was how AI, which we developed as Healthy Health Assistant, came in. And, at the beginning of this presentation, we talked about the fact that even the AI, the Healthy Health Assistant, the chatbot, can be put in different languages. So one of the things we did, we worked with, the IT experts in REAN Foundation over several months to produce content, and then, worked with those who are into languages to even do translation of some of these things. So as of the moment, the information is in English, in Hausa, Yoruba, and Igbo language, the 3 major Nigerian languages. And what does this thing do? Every individual who is on the Healthy Health Assistant can easily, one, improve his knowledge about hypertension, ask the chatbot any question and will receive an answer. 2, support the individual to plan reminders about his medication. Because we have also discovered that a lot of people who are hypertensive, that one of the major challenges is that they don't take their drugs according to doctor's prescription. Then 3, it can also remind you about your clinic appointments. It can, take care of, some of the lifestyle changes, physical activity, like Lillian has mentioned. So we try to find out, is it possible that this thing can be deployed in low and middle income settings like ours? So we decided to leave Abuja, which is the capital city of Nigeria. We felt that our best bet is to try it in a place that may not be as robust economically as Abuja. With our colleagues in Abakaliki, Abakaliki is in southeastern part of Nigeria, and we have colleagues there who are already developing a lot of interest in digital technology. So we tried it there, and what are our findings? We found out after deploying this thing for 1 month, one, that it is feasible to try this amongst people, and that 2, it is not even dependent on their educational background, that even people who are not that educated could use the Healthy Health Assistant. 3, we found out that medication adherence improved significantly within the period. 4, we found out that even the feasibility of doing it as far as the health workers is concerned was also very good, and usability was very good. So the implication of this finding is that if this is deployed even on a large scale in a country like ours, that it will definitely improve control of hypertension. I don't want to share some of the other experiences we have based on some of the things that has happened there all over the world. But just talking about our own experience here in Nigeria, just this afternoon, I was talking with a young man who was the primary person who did this trial in Abakaliki, and we are even trying to develop some other ways we can use this to help in improving cardiovascular health among our people in the area of diagnosis, in the area of treatment, and even in the area of rehabilitation.